Ask the patient kindly if it is okay to expose the part of her abdomen for our following examination. Make sure that she consents first before doing so. Inspect the abdomen of the patient. Check for abdominal distension, presence of prominent vessels, striae, pulsations, peristaltic movements, and movement in relation to respiration. Examine also the umbilicus as well.
Bowel sounds are gurgling in nature, and they occur episodically at 5 to 10-second intervals or longer. And in younger children and in infants, it's usually around 10 to 30 seconds. Also, an occasional barbarigmus sound or loud prolonged gurgle could also be heard. Aside from bowel sounds like gurgles, there are also bowel click sounds that could be appreciated, and the normal range is around 5 to 30 per minute. The abdomen is normally tympanitic on percussion except when percussed over solid organs like the liver or a full bladder. Abnormal dullness suggests fluid or a tumor. In a highly tympanitic abdomen, suspect colic, intestinal obstruction, or ileus. Determine the liver size or liver span. Percuss along the midclavicular line parallel to the ribs and mark the intercostal space where dullness was first noted. Another helpful technique that we could do to determine the liver size is by doing the scratch test. So here, I'm placing the stethoscope just below the xiphoid process, and lightly I'm scratching the area parallel to the expected liver border. So on the area where the sound waves are transmitted very intensely, then that's the area where we could mark the lower level or lower border of the liver. Before we begin with the palpation, you might want to ask your patient first if there's an area of the abdomen that's especially painful. So you will want to direct your palpation away from the site of the pain, proceeding gently towards the painful area. Aside from direct tenderness, we should also check for rebound or indirect tenderness if it is present. So this basically felt or is greater on the release of the fingers, like what I'm doing here. So you just observe the patient because if it's present, then it's indicative of peritoneal irritation. Now, to proceed to the palpation of the liver, if there's marked hepatomegaly, we would observe the left lobe of the liver to be palpated over the epigastrium, extending to the left subcostal area. Now, to proceed with the palpation of the spleen, so it's not usually palpable, no, unless it's already enlarged at least 2 to 3 times its size. If there's a pathologically enlarged spleen present, it's usually palpated under the left causal margin during inspiration. You could also ask your patient to lie sideways and gently lift the left flank of the patient ventrally to better facilitate the examination. Now proceeding with the kidneys, so it could be palpated with one hand placed posteriorly with the other hand positioned anteriorly below the costal margin. The kidney is best felt at deep inspiration. Occasionally, we could feel the left kidney or palpate it in thin or malnourished children. Now, to elicit the causal vertebral angle or the CVA tenderness, we should examine our patient sitting up on the bed or the examining table. Now, take note that we should only do this in older children or adolescents. So then, we use the heel of our closed fist or the ulnar side to strike firmly on the CVA. That's the angle between the 12th rib and the transverse process of our upper lumbar vertebrae. Then, of course, ask the patient if she could feel any pain or tenderness upon striking.